this information is not out there to the general public, and there's a lack of education about what should we do if this is what happens to our body. There isn't a single known cause of why one person will experience pain with erection or ejaculation and why others don't. There are many theories, but none that have been entirely discovered. So in my clinical practice and the research that I have done and read up on, there are things like direct trauma to the tissues, whether from sports injuries or whether from sexual activities or explorations. And not saying that these are bad things to do or to avoid, but it might just be the trigger, the catalyst to sensitizing these tissues, the neurovascular tissues and the tissues in general in this area. Starting with a basic male pelvic, the orientation of muscles here, you can see here's the base of the penis, here's the anus, and then these are muscles again attaching at various sites. These muscles function to squeeze and release. They also aid in helping to maintain an erection, to help maintain the blood flow with the penis as it engorges. So within the penis itself are it's soft tissue. It's tissue that has spaces that can fill with blood and also drain. It is oriented in a way with the specific sexual tissue within the penis that is surrounded with muscles and neurovascular. These structures, just like any part of your body, has the potential to get injured. So whether that's with sexual activity or sport or anything else for that matter, these tissues can get injured. But just like other parts of your body that get injured, they also heal. This information is not out there to the general public, and there's a lack of education about, well, what should we do if this is what happens to our body? And how do I go about handling this? And who do I even go see? I think those are the main obstacles to really understanding and applying strategies to help with the healing process should there be an injury. And it's not uncommon for us, again, not to even talk about, well, this is why, it hurts because, I tried, masturbating in this way, or I tried something else, or it was a sexcapade, or whatever it was. For a lot of us, that can be really embarrassing to even talk about. I have worked with people who had experienced, great just suffering from this. So I feel like the sooner we can educate and have people feel comfortable about their bodies, the less scary it will be if there's something that should arise.